Hello everyone. So I have invited Dr. Pradyuman Rajput, and this is our third video. We have made video on public health through community pharmacy. We have made video on how AI hesitancy holding pharmacies back, and you can watch all this video, which is available on my YouTube channel, which can be seen on the screen at the end of this video. So in this video, we are going to discuss about what are the AI tools that can be useful for the pharmacy and the healthcare. So you can please start.
Thank you, Adnan, for having me again. It's good. Okay, now screen is visible, maybe.
Yeah, it's visible.
So I'm Dr. Pradyuman, PharmD, community pharmacist, and I'm also, a lot of AI things and just tinkering out things on how we can improve our practice with the use of AI tools. So currently in this presentation of ours, we will be focusing on the how we can, improve our practice using AI tools and how, we can empower the clinical decisions and then, improve patient counseling, learning, and even documentation through trusted AI tools. So as you can see, I have mentioned the tools which we will be covering because ChatGPT and Gemini are quite prevalent in the general population. But we as a pharmacist need evidence-based medicines that evidence-based guidelines and even treatment algorithms and even counseling points for the patient that helps and actually is not a is not a content that does not exist. So we don't want that. So we want everything that is evidence based. And ChatGPT and Gemini score a bit low compared to the other tools which we will be covering in this video. And let's move ahead. So if you can see, okay. So what's the role of the AI in the modern pharmacy practice? So the drug information is rapidly evolving. We are, pharmacovigilance is active quite, we are finding new interactions, new, side effects that are occurring in the population, and that is being updated on a regular basis. So based on that, we need to be, quite adherent to the new guidelines, new treatment, new information that is available out there, because what we studied back then might have changed till now. So we need to be quite updated on that. Then we have a time pressure. We have a counseling, patient counseling part, and we also have a time constraint because we have to go through a lot of patients. So we need a quick thing that helps us in the patient counseling without missing any information there. Then we have to keep up with the clinical literature as well. Then there are complex drug-drug interaction that might happen, which we might miss. So we also have a documentation burden because in our ward rounds, in our everyday practice, we also need to document everything that is being done by the pharmacist there. And then what is the problem which we are facing is inconsistent AI outputs from the tools we are using. Mostly people are using ChatGPT and Gemini. And what is the problem there, that thing is not purely evidence based, or it might be happening the AI tool might be hallucinating some of the information which does not exist, and you cannot trace it back. So you need everything that is properly traced back and has a proper background and even citation, so that you can cover up whenever those things are needed. So we need some AI tools that replace guesswork with citations, reliability, efficiency, and support the four domains. So what four domains we are focusing on is these four domains. First is clinical decision making. So since every time a pharmacist goes for a ward round or even glances at a prescription, he comes to identify the part, like if the following drugs are interacting, if the dosage is proper, if the algorithm is being followed, if the proper antibiotic selection has been made, then so yes, we need to check up with the drug references. Then we need to check the interaction, because on every prescription encounter, we need to make a clinical decision. And then we need to verify all those things with a AI tool, which we will be discussing on. And the AI tool for clinical decision making, which I have identified is Perplexity, which would be a good tool. We will be discussing it in later. Then we have patient counseling. For patient counseling, we need an empathetic human voice that translates the clinical information into information that the patient can understand and properly get it on his on our communication part. And then we have learning and research for our own literature synthesis, or we need to identify any concept, or we need to improve our knowledge. For that we need also tools. And then we have documentation. So for documentation, for accurate, structured, efficient ways, we need to document. So we would be going first into the clinical decision making. So if you see, the common mistakes with ChatGPT or Gemini is that there is a lot of fabricated drug references. There are no, real citations there. If you tell the tool to generate citations, the most chances are that citation does not exist. So we need to avoid those things. Then outdated dosing information. It might be happening the dosing information which we are receiving is not up to date. Then we might miss critical drug interactions there. Then inability to search with the real time database. So what we need to do here, and as I said, hallucinated guideline codes. So these all pose a risk for the pharmacist as well as the credibility of a pharmacist, and even for the patient. So what we need, like here, how Perplexity is eliminating that. So we get a real-time citations, then we have the current data because it searches through live databases, and then we have reliable interactions that we can verify, and transparent sourcing. Pharmacists can easily claim on those things. So we would be going with a demo where we will be exploring how Perplexity is giving citations. So I will just share a different screen now. Okay. Okay.
Huh.
So now the screen is available. We are on Perplexity here, and now we will be trying to identify how Perplexity can help us. So just if we need to check like what are the current Indian standard guideline on H. pylori eradication. So based on that, based on the query we give, it will identify the guidelines, and also it will identify the international guidelines what are available. And see, it identified the last guidelines that we have, like for 2021 Indian Society of Gastroenterology consensus. So what they proposed, we can simply identify, and every here reference is backed by the evidence, so that you can directly go to the specific uh, article to verify if those things are correct or not. So based on here, you save time in clinical decision making. And then if we are to again check for some another things, like we can type a new question like what are the statin guidelines for 20. Typing error. Edit then. Okay, so like what are the statin guidelines for primary prevention of CVD? So it will identify all the possible latest guidelines around it, and then we will have a guideline. So in 2026, an ACC/AHA, American Heart Association Multi-Society guidelines we have, and then we can identify what they have suggested, like what are the goals for, and what are the indications, and what are the targets that one needs to focus on. And then based on that, we have to choose what are the statin recommendations. So like this, every information here is quite backed up with the evidence that is available out there, and it's a better for clinical decision making. So based on that, you need to use small prompts, directly oriented, and you can ask various things, and Perplexity would give a good, answer that is quite evidence based. So now we'll move to our second domain. So second domain is patient counseling. So patient counseling, what we are facing like mistakes with the Chat GPT and Gemini, that they don't provide a human voice that we can communicate with the patient, and it also misses a patient specific factor based on the age, the literacy part, the culture part, and it is a more of a clinical language than a layman language. And then it has an inconsistent tones. It does not give a proper, it gives all the alarming things also and even the casual things also, and it fails to flag when we need to refer to the patient back. So how, what we are using here is we are using Claude that improves the patient counseling part. So for that, it provides a tailored communication and empathetic tone, a layperson explanation, and safe escalation queue when you need to refer the pharmacist and when pharmacist refers to the further care in the chain. So now we will take a look on how we can use the plot part. Is it visible, the plot part? Okay. So, we are using Claude here for patient communication, SOP, summary, or writing part. So, like we can use a simple thing that we have a newly diagnosed type 2 diabetic patient, and we need to write to patient on metformin, dapagliflozin, vildagliptin, which are there on the prescription. We need to provide counseling in a clinical language as the patient has poor literacy. That's it. And draft a leaflet. So here, like you can simply give the conditions of what is the status of the patient and what tone he would be easy to understand with, and then that thing can be simplified with the use of Claude. So it will take time, but it will identify a proper thing, and in a short while we will have the leaflet ready. Claude has finally generated us a medicine guide that we can print it to the patient and even give it to the patient as a retention material, and we can simply take a printout of it and explain those things to the patient and give the physical copy as well, so that he would understand what he's taking the medicines for and what are the medicines, how it will work, and what are the conditions that he needs to see around it. So if you can see, it has described the diabetes in a quite layman term. Then what are the medications that have been prescribed to the patient, and how those medicines need to be taken, and what it could cause as a side effect, and when you need to see with the doctor. And then we have each drug wise we have the things that what needs to be taken care of, and what are the main complications that we almost face on anti-diabetic prescription is a low blood sugar. So what one needs to do, even that is even given, and even a daily tip for good diabetes control. So by this using this thing, we can help a patient adhere to the treatment for a longer period of time, and that improves even the part as a pharmacist on the counseling part, and even for the patient in the disease outcomes. So this was the patient counseling part. So we move back to the third domain. Okay. So the domain 3 is learning and research. So as a pharmacist, we need to keep up ourselves updated, or if we are seeing any complex cases around our practice, like in the community or in the hospital settings, we need to identify what we need to learn more around it, and we need to identify more things around it which we don't know, obviously. So the tools which we need to here use is PubMed directly. PubMed as a resource, we can identify articles from there and directly use it with Claude. Then we can also use Google Notebook LM. That also provides a good, material for learning and research. Then we have an AI called Elicit that we will learn, and we have an Open FDA resource which we will learn how to use it. So certain mistakes that ChatGPT and Gemini makes here, it doesn't summarizes the paper because it never actually read. Then it fabricates author name as we discussed. Then it cannot synthesize multiple papers accurately. Then it has no access to the paywall or the recent literature, because most of the articles are uh, protected behind the subscription thing. So not everything is available for the AI to answer with, and that causes it to give us shallow answers. So how we will eliminate all those things? So we have the software to elicit the PubMed. They have the resource and even the notebook LM, and how we will synthesize all this to use to assist pharmacists, so that we actually get a good research around what we are working. So we will go one by one. Okay. So first of all, we will be learning around how to identify like a new drug that has been put into the market. So how we need to learn the new drug. So basically, okay. So we have a website called DailyMed that is by National Library of Medicine only. It's a part of PubMed, and there you can put the new drug. So for example, we are considering the new drug that is semaglutide. Okay. So it's a quite famous drug in the market nowadays, and we have all the package inserts that are there in the medicine as well. So we need to just click on it, and then we can have a complete PDF of it here. Okay. So it has the PDF that has 47 pages of information, I guess 62 pages of information. So for a pharmacist, it's okay to take time if one has time to visit all these things, he can take those parts. But if he doesn't have time and he needs to identify what are the things that I need to learn, so using Notebook LM, we would be like here. This is Notebook LM. We will be simply uploading our document that has been downloaded from the DailyMed, and then it will read the document on hold, and then we can simply learn from it what we need to learn. And then we can use the document as a reference material, because we'll identify things that what we already know, and in things where we need to learn more, we can directly go back to the reference document and simply go out to the specific place and learn about it. So here it will take time a bit. Till then, stay along. So now we finally have our, output ready. So once we have feeded the prescribing information that has been, taken from the Daily Med, and that is by the official company Novo Nordisk, that drug label information, and then we can learn based out of it. So I just clicked on the mind map, and we have the mind map ready. So here, as a pharmacist, for learning new drugs, we can simply, paste those things, and now we have all the indications that it has been given for. Then we have the dosage and administration part, and what is the, dosage available in the market, and what are the instructions for the medicines. Then we have the warning and precautions, what needs to be taken care of, like thyroid C cell tumors can happen with the following drug, then following all the injuries can happen. Then there is a contraindication. It can cause, hypersensitivity and some syndromes. Then the drug adverse reactions. Other than that, currently new identified things are like, eye blindness that is quite often observed with this treatment. And then what specific populations need to take care of. All those things that we can learn here are available. And what's the, mechanism of action. This is all in short, just an idea of how we can, make use to learn new drugs around it. So we can also generate flashcards around it, infographics around it, and slide deck around it. And we can ask any sort of question like what is the frequency of eye-related adverse effect? We can directly question things to the document, and it will explore the material and answer us based on that what it was observed in the following treatment. So like here, 4.2% patients, reported poor glycemic control, and diabetic retinopathy was observed primarily. And then another yellowing of eyes was seen. Then what needs to be monitored for the progression, everything has been mentioned. So now here, like we can ask different related questions to the same document and get a better picture of the drug. And we can, also tailor it to the patient we might be observing in our practice, and that could help us in a proper, acknowledgement of all those things, all the literature, all the information that is available out there by the company as well as the researchers, what they have to say around it. So this was Ozempic, and then we will move to another research topic. So we will move to PubMed, and we will identify some new things like how we can use the evidence, and then use Perplexity or Claude to summarize all those things. So like we can search around carbapenem resistant Klebsiella in India, and we can identify articles around it. Okay, so using PubMed is quite a simple thing. One needs to tailor out the years which he has been focusing on, which evidence it wants. Like, and then we can also, based on the article type, we can choose for meta-analysis or randomized clinical trial or any systematic review, which might improve the quality of the evidence which we might be looking forward to. So based on the titles, I guess this is a study we can use, because it has a picture of clinical outcomes in ICU patients. So does it affect anything? So we can take from here. And because if we don't have time to properly interpret it or what's into it, we can simply copy those abstract and give it to Claude to summarize it. Summarize the following article. And it will simply identify all the key findings and takeaway that one needs to take. And you can, more of that, you can ask more questions around it. So here it shows like 116 patients were taken to compare the outcomes for carbapenem resistant and carbapenem sensitive Klebsiella pneumonia bloodstream infections. So, 7, predictors of mortality were identified. So based on these, we can tailor the treatment into a different thing, and like here vasopressor use within 48 hours was quite a thing. So everything, we can correlate and use it for our information in the practice. So any tool left out? Okay, yes, we have a tool called Elicit. Okay. So we have a tool called elicit.com. In the free version, we get only 5 prompts a day. And there we can, identify a literature review based on our query, which we need to look upon. So I'll just put a query, like a simple query, like we can do is like, does, sorry, does PPI profile access improves, reduces GI bleeding in ICU patients. So first of all, we need to put the question up here. And here we have a sort thing that will identify if the following question is a good research question or not, or is it vague. So like if I simply remove the ICU patient part, it will re-evaluate the question strength. But we need to get it tailor one. So simply like we have done, and we will search for it. So what it will do, it will act as a literature reviewer. It will identify the literature and it will select the articles based on that. And it will provide a summary of the question you asked based on that. So it is providing you a literature review in short. So see, here is the final answer based on 10 articles it identified. Okay. So like yes, prophylaxis reduces GI bleeding, but the strength of evidence is mixed. So there are certain studies that shows that it promotes and certain that it does not, provide no significance result. So all those articles you can identify, and those articles have a proper summary. You can also have the DOI so that you can access those articles, and you can alter your question and go around it, and you can include the study type which you need to want. So you can have a great evidence that is reliable even for the physicians that might ask where you came with the evidence. So when you have a 10 paper evidence with you, you have a quite a evidence that you can counter to the physician. So like here it identifies 10 result, and we will check with also a new question. So we have a new question there, and again it will identify papers around it, and it will come up with a answer that is based on all the evidence which we it identified. And yes, like here it shows that effectively reduces adverse drug events in hospital settings, and however evidence quality might vary. So this is the software, it's an AI, so you can use it to identify new questions, new everything. Even it shows you things like you can choose like efficacy comparison of statins in hyperlipidemia. So see how it works. We'll simply identify papers around it and then give you a summary, a result that you can explore into. एक बार रिजल्ट आता है तो बताता हूँ कैसे काम कर रहा है। here is the answers which we get. So it runs an analysis based on some prompts that it identifies and search for academic articles around it, and then it identifies the sources. It also identifies which were included or which were not included. You can have a proper summary of all those articles it considered and which one it rejected, and then based on all these sources, it identifies the result which we are looking for. So see here it has, one network meta-analysis ranked LDL lowering efficacy. So it has also ranked all the studies that were there. These are the drugs that it ranked, and then how systematic reviews and various other articles that promoted the same thing, and you can, identify. So we can ask more questions around it and have a good picture of the question we are looking into. Okay, so we identified the things like PubMed, the Cloud, the Notebook, LM, and the LSET software for learning and research. Then we'll move to documentation part. So in documentation, obviously the prompt quality matters, and you can feed your documentation, the Excel files that you generate, and then you can have a good reports around it with the use of Notebook LM, and Claude can help you draft the outcomes of the notes or the study that you did at your hospital or the community practice, and it provides a consistent formatting also, and it makes you easy to as a pharmacist to communicate your outcomes to the patient and as well as the upper bodies that you might be working with, like in the hospital with the Department of Internal Medicine, everything. You can provide a proper report around it and show your impact in the community and in the hospital practice like that. So overall, it was why ChatGPT and Gemini falls low for the pharmacy practice. What it lacks is identified by the use of Perplexity and Notebook LM Claude, and even the mix use of PubMed, OpenFDA, and Elicit, and how you can integrate into your clinical workflows for preparing better reports around it, and how these are transparent sources as well as reasonable sources which we can get. So at a glance, it was Perplexity, Claude, PubMed, Notebook LM, Elicit, and for different domains that we discussed: clinical decision making, patient counseling, learning and research, and documentation. So that's it. So use AI wisely and practice better, and stop using ChatGPT for everything. You can use the right tool for it, and you can simply make it good.
But this is more about the practical, hands-on working experience with the AI tools that can be used in any part. Just keeping up the right prompt with the right AI tools that can give you a best result. So if you have watched till here, I'll be sharing a free certificate course link in the description of this video. So you can go and watch that course and you can get the certificate. And thank you for watching. And it was a wonderful presentation by Dr. Pradyuman Rajput. And we will come again with some unique video in future. And till that time, stay tuned and bye.
Thank you.
Thank you.